I specialize in minimally invasive surgery. I treat all my stones with minimally invasive techniques. Any case that can be done with the robot, I absolutely use the robotic technology. A lot of people ask about the surgery robotically and what exactly that does. And I kind of give them a timeline of how we've treated kidney cancer over the years. Initially, it was a large open incision, even an incision where ribs had to be removed, which was very painful to remove the whole kidney. Then it was down to partial nephrectomy, where we could remove just the mass with a rim of healthy tissue, but that was also with open surgery. Open surgery, either in the front or the side, cuts through a lot of layers of muscle in the abdominal wall. That's very painful. People are in the hospital for a while getting that pain controlled. So robotic surgery has a number of advantages over laparoscopic, or what's called keyhole surgery, as well as advantages over open surgery. Starting with smaller incisions. We only need to make incisions about the width of a finger breadth. Usually we make 5, sometimes 6 small incisions in the abdomen. The risk of needing blood transfusion and risk of blood loss is also lower because the belly is blown up with carbon dioxide. Any little blood vessel that wants to bleed is sort of squished just a little by that carbon dioxide pressure, so less blood loss. That's an advantage over open surgery. But now we attach the instruments to a robot, and the surgeon sits in the corner in a console. The robot gets you a whole number of advantages surgically. You have 3D vision instead of 2D vision. The robot gives you magnification of the view, and you can even change the level of magnification. It gives you risks, where laparoscopic surgery, your instruments can go in and out of the body. You can open and close them, and you can turn the entire instrument. Robotic technology gives you risks, so you can do this. So this doesn't seem like that big of a deal, but when you're doing a reconstruction, it makes a world of difference to be able to do that. Not only do you have wrists, you have what we call supraphysiologic or super wrists. So my wrist can turn like this, but the robot wrist can turn like this, if you will, 720 degrees. So that is very important when we're sewing things back together after we've removed the mass or removed the abnormal tissue. People have shorter hospital stays. They don't have to stay in the hospital as long. They have less need for pain medication. Quicker return to their normal activities. Their restrictions on strenuous activities and lifting heavy weights are shorter because their incisions are smaller and the risk of hernia is lower. So they can get back to work. They can get back to, playing with their kids, whatever they enjoy on a faster basis. Early on in my residency days, it was mostly hearing people talk about it, but I did do a case or two where we made a huge incision. Removing ribs is very painful. These incisions are very, very painful. And to be able to do the same thing and get somebody's kidney cancer or prostate cancer or bladder cancer taken out with little incisions instead of a huge incision and hernias and pain and all these things, it's fantastic. I mean, you can't ask for anything better.